Let me talk to you about a very common phenomenon that Invisalign providers and patients deal with that can be the subject of frustration. Now, I'm using Invisalign software and showing you, in fact, an Invisalign case, but let's pretend this was a patient who had lower braces. And here you can look at the lower crowding. So if you're not a dentist or an orthodontist, and you just look at this, we can all agree that this is rotated and crooked. And here you can see how nicely aligned these teeth are over here. If this patient had braces and the braces were removed, and then this was revealed, the patient would be very happy. And having done braces for 30 years, I maintain that the patient would be totally ready to have a retainer. Now, if this was an Invisalign case, here is the same before and after. And it looks great, just like I said before, if the braces were removed. But what I want to show you, this tooth right here was the most crooked to start. I think you could say maybe this one as well. And now notice how this tooth is just slightly back compared to this, and this is slightly back. And you can see at the click of a button, if I were to order another 5 aligners, you see how that does seem to look better. Now, here's where this is interesting. So when you do Invisalign, this patient required 28 aligners. And at the end of 28 aligners, quite often the teeth don't even look quite this good. But they could. But maybe you need a second round of aligners, which is very common and part of the process. But let's say you do that refinement round, and now you're left with this. Well, is this good enough? Well, if the teeth were made a little straighter, this would not give them any more stability. It's not like these are puzzle pieces that are locked in place and now they can't move. And also, the change from here to here on a screen looks noticeable, but in the mouth, it really would not look better. Now, that doesn't mean we wouldn't aspire to this, but the factors that are involved is, let's say this patient was already happy with this result and maybe not wearing their aligners enough. Think about somebody who maybe sets out to lose 30 pounds and then they get to the point where they've lost 25 pounds and they look great, and then they get a little satisfied and they start eating poorly again. So sometimes patients don't wear the aligners enough because they're getting tired of it. Maybe they never wore them that well to start. Is this an acceptable result with Invisalign? Well, it depends on the case. But the point is, compared to braces, where the braces come off and the patients really haven't looked that closely at their teeth, and then you reveal this, they're just thrilled to have their braces off, and this is a great result. But with Invisalign, the patients are looking at their teeth every day, and there's high definition photography now. They take their own selfies, they look at it, and kind of the goalposts get moved. So this patient right here, maybe they get to a point where their teeth are looking like this, and they think this at a certain point is what they remember as the start. They forget that it really looked like this. And so when you price out a case with Invisalign, some offices will include all the refinements that are necessary and charge very high fees. Other offices will charge moderate fees that are conditional on a certain time point. And I have patients where we get to this point, this degree of correction, where if they've already used up 1 or 2 refinements, if they're not wearing their aligners enough, I may say this is as good as we're going to get it. And the patient will have to understand. And then if somebody is upset about that, then they may have to pay more money to give that last little tweak. Some people say, I think it was Voltaire, that excellent is the enemy of good. That should not give us permission to not try to get the very best result. But Invisalign can get a bad reputation unfairly if you have a patient who you have here and you want to get to be in this point, and you're spending 6 months to do this because the patient is not wearing their aligners enough. And so just a little bit of background on setting reasonable expectations and how a result might depend on the length of the case, perhaps the treatment fee, and of course the cooperation of the patient.